Hello, everyone. My name is Joe Tibbs. I'm the president of HAPevolve, and I'm really excited to have with me Dr. Hamad Husainy, who is the chief medical officer of one of HAPevolve's industry partners, PointClickCare. Dr. Husainy, thank you so much for taking some time with us today.
Thank you, Joe. Happy to be here.
So before we kind of jump in, can you just introduce for people who are watching who don't know, who is PointClickCare?
Here at PointClickCare, we are a electronic health record for post-acute care facilities started about 25 years ago. And so we are very committed to the post-acute care facilities and the care that the elderly are being provided. We also transitioned about 6 to 7 years ago, recognizing the incredible importance of value-based care and the needs for being able to share information real time to make the most appropriate quality medical decisions, but also with respect to utilization and cost. And so really today we're in a position where we can share that information and be a care collaboration and care coordination platform for acute health systems, payers, ACOs, and also sharing that data back with the post-acute care facilities to create the ecosystem we all desire.
Dr. Husainy, one of the things that I know I've been speaking to a lot of healthcare providers or healthcare leaders about is the challenge around readmissions, and so hopefully you discharge a patient to their home and they're fine. Often you discharge a patient to some sort of non-acute facility for additional levels of care. And I know PointClickCare does some really interesting things around helping reduce those readmissions. Can you walk us through a little bit about what it is that you provide and kind of how you go about doing that work?
Yeah, absolutely. So readmissions are a big deal because for several reasons, patients that get readmitted to the hospital have a higher morbidity and mortality. And the way we look at it here at PointClickCare, and I look at it as a clinician, is we have to have a proactive approach and a reactive approach. So one of our proactive approaches is how do we monitor these patients from a single source, a single sort of portal, and be able to look at all the patients across the care continuum that go out into the skilled nursing facility sort of world, and be able to have visibility into who's doing well, who's not doing well, who do we need to add more resources, who can we take more resources away from, to really understand which patients are moving in the right direction, which patients are moving in the wrong direction. And then from a sort of reactive approach, what happens when those patients get sent back to the emergency department? Now bringing that information to the ED physician, having them understand the fact that a patient is in a post-acute care facility, they do have opportunities at IV antibiotics or IV fluids, and they do have a care team looking after them. And so now you have confidence that you can send that patient back to the skilled nursing facility. And so is reactive better than proactive? Well, they're both opportunities to at least address the problem. But what we've recognized and seen through data is that a proactive plus reactive approach seems to be the standard that we think provides the best coverage.
Beautiful. Dr. Husainy, you've talked to me a little bit about the vision of the electronic health record being the ability to seamlessly communicate patient information across standards of care and across organizations. And unfortunately, that's not necessarily the experience of a lot of hospitals today. Can you walk us through just a little bit about what the PointClickCare system does to enable better clinical activity and clinical behavior at organizations that opt for it?
Yeah, the electronic health record, it was sort of a new thing when I was in residency, and we all had these like grandiose visions that this was going to be able to, we were going to be able to get all our information from everywhere we ever wanted, and it was just going to like close all the gaps. And at the end of the day, we were like, this is going to fix healthcare. And to be honest with you, we have a dichotomy in healthcare where we have to chart in a way that supports our document. Our documentation has to support our billing practices, and so it has to be super in depth and super complicated and super deep. But the reality is the way we consume information is in a much more simplistic way. And so trying to create a platform where we can consume data oftentimes through AI, to be able to take that data and present it in a way that it's usable. That's the transition here. And so EHR serve their purpose. They're great repositories of information. They're great partners of ours. And heck, we are an EHR in the post-acute space. However, what we're trying to do now is take that in a way to make it usable. And it's exciting to see the outcomes.
Can you walk us through a little bit about what a client would expect when they choose to engage with PointClickCare? What's the ramp up period? What's the value proposition for them?
When an organization works with PointClickCare, basically there's an integration into the EHR. The most important thing there is that it's pushed, it's standardized, it's digestible, it's usable, and it's actionable. If you have a product that isn't all of those, unfortunately, in the ED with the frenetic pace, it's just not usable. And so it integrates right into the trackboard. There's no separate login, and the clinician can actually see it before they go see the patient. Nursing can use it for med reconciliation, and as well as the hospitalists or other care team that might be able to use it because it is a source of truth. It's real time. Now, looking at it on the back end with some of our more like discharge products from the hospital and being able to share information that way is how do we get more clinical information in the hands of both the skilled nursing facilities, but also leaving that avenue open for skilled nursing facilities to share clinical data with the health system who's trying to proactively manage these patients that go out into the skilled nursing facility environment and then ultimately home. So by providing your data, you're helping a patient that's going to an alternative health system. And all of that data that we have is helping you because oftentimes you have a lot of data in your EHR and it's deep and it's long and it's complex. However, being able to provide data from the community and other health systems and health environments is very helpful.
Can you walk us through like what does a perfect transition look like from your perspective?
Yeah. A perfect transition is really almost hard to accomplish. But at the end of the day, the reality is that these transitions is where we lose the most momentum and we dissipate the most energy. And so what happens is the more opportunity that we can to sort of grease the skids for these transitions, the better we will. Having real-time data, being able to share that data from health system to post-acute care facility and post-acute care facility back to the health system or to the ambulatory network is really what's going to drive the quality. And so when you're trying to make decisions at these moments of transition, the question we always ask folks, and I always ask my fellow clinicians, is it better to ask those questions with data or is it to walk in blind? And I think the answer is obvious, and there's great data to support how the results that we have gotten and what clinicians are using with this data.
Well, Dr. Husainy, on behalf of myself and HAPevolve, I wanted to say thank you for sharing a little bit more about PointClickCare and some of your personal experiences. For those of you who are watching this video, there's more information about PointClickCare in the description of the video below. And feel free to reach out to anyone at the HAPevolve staff or any of the PointClickCare folks to learn more. Dr. Husainy, thank you so much.
Thanks for having me.